Okay, so that last one ended at vitamin E. I'm just going to review it quickly here. So what I was talking about is there's no evidence of adverse effects from consuming large amounts of vitamin E naturally present in foods, but the amounts typically contained in supplements are also safe for most people. However, large doses of vitamin E can interfere with blood clotting, so individuals taking blood thinning medication should not take vitamin E supplements. We do know that the upper limit is 1,000 milligrams a day from supplemental sources. This is a graph that shows the dietary sources of vitamin E, including sunflower seeds, nuts, peanuts, and refined plant oils such as canola, safflower, and sunflower oils. We know that vitamin E is also found in leafy green vegetables such as spinach and mustard greens, and in wheat germ and fortified breakfast cereals. The dashed line here represents the RDA for adults of 15 milligrams of alpha tocopherol a day. So vitamin K, you may hear a lot about that, especially if you're a nurse or you're going into healthcare. So blood, we know that we need vitamin K. It's a part of our clotting factors in blood, and we know that blood is a fluid and that it flows easily through your blood vessels, but when you cut yourself, blood must solidify or clot to stop your bleeding, and vitamin K is needed in the production of several blood proteins called clotting factor that causes blood to clot. And the K in vitamin K comes from the Danish word for coagulation, abnormal blood coagulation is the major symptom of vitamin K deficiency, and without vitamin K, even a bruise or a small scratch could cause you to bleed to death. What we know is, here's a picture of someone who's bleeding, and we know that the blood clotting requires a series of reactions that results in the formation of the fibrous protein called fibrin, and fibrin fibers form a net that traps platelets and blood cells and forms the structure of a blood clot. Several of the clotting factors, including prothrombin, require vitamin K for synthesis. So if vitamin K is deficient, they are not made correctly, and the blood will not clot, like we can see in this picture. What we know about anticoagulants, for those of you in healthcare, is that warfarin inhibits the formation of active vitamin K, so blood does not clot. And we know that blood clotting is essential for survival. And the drug, we can see here, you see where the X is, so the warfarin inhibits the vitamin K, and so those who have are on warfarin, we have to be cautious about their vitamin K intake. So what is the RDA for vitamin K? For men, it's 120 micrograms a day, women 90 micrograms. Our biggest sources of vitamin K are leafy green vegetables and some vegetable oils, and we know that a deficiency can cause abnormal blood clotting, causing bruising and bleeding, and reduce bone density, causing fractures. And we know that there is no excess on reported effects from food, but large doses can interfere with blood clotting. So the thing I want to point out here is for those patients on warfarin or Coumadin, it's a consistent intake of vitamin K. So physicians typically dose warfarin based on their patient's prothrombin times, and any serious deficiencies or excesses in vitamin K can change those factors and can cause bleeding or clotting issues. So consistent intake of vitamin K. You do not want to avoid vitamin K on cont'd. Here is the list of the vitamin K sources, and we reviewed those already. So let's do a summary of the fat-soluble vitamins. Be sure that you know maybe some food sources, major functions, deficiency diseases and symptoms, and if we have levels with toxicity of these vitamins. So supplements, do we need them? So we know that supplements contain vitamins and minerals, herbs, and other plants derived from substances or body compounds not essential in the diet. Supplements help us obtain adequate amounts of specific nutrients, but we don't get all of the benefits, like the benefits that we get from food when we take supplements. So we want to choose our supplements with care. Supplements are recommended for certain populations. Dieters, people that are consuming less than 1,200 calories a day, are recommended to take a multivitamin mineral supplement. Vegans and those who eliminate all dairy foods may not meet their intake for B12 or calcium or vitamin D and may need supplements. Infants and children are often supplemented with fluoride, vitamin D, or iron, depending on the circumstances. We know that young women and pregnant women, childbearing age, need folic acid supplements or fortified foods to prevent issues with fetal development for folic acid deficiency. Older adults, we know that they have a high incidence of atrophic gastritis for those over 50 and may need B12 supplements. Also, some older adults we talked about that may not meet their vitamin D and calcium, so they may need supplement. People with dark skin may be unable to synthesize enough vitamin D if they are not exposed to light. Individuals with restrictive diets, maybe a lot of people are on restrictive diets these days, and not always for the right reason, but sometimes for medical conditions. And if they're on a very restrictive diet where they're eliminating whole food groups, they would need vitamin or mineral supplements. People taking medications that may interfere with the body's use of certain nutrients. So some medications have drug-nutrient interactions and can inhibit the absorption or increase the excretion of certain nutrients. And we know that cigarette smokers and alcohol users, people who smoke, need more vitamin C, and possibly vitamin E than non-smokers because of their risk of cancer. And we know that alcohol consumption, we talked about Wernicke-Korsakoff syndrome and some B vitamins because alcohol interferes with B vitamin metabolism. Herbal supplement, so what's an herb? It's a non-woody seed-producing plant that dies at the end of the growing season. So it refers to any botanical or plant derived substance. This picture here does show some of the common supplements that people are taking. There are some potential benefits but side effects of common herbal supplements. You can kind of review those, but I think the thing that I'd like you to know most is that the FDA does not regulate supplements. I think we learned about that, and you're learning about this in this week's video. Various serious issues going on with supplementation right now. So choose supplements with care. Consider why you want it. Compare products and costs. Read the label. Check the expiration date. Consider your medical history. Approach them with caution and report harmful effects. And I would say on here, don't give them to children unless you've spoken with a pediatrician regarding that. And that's the end of Chapter 7. And have a great week and enjoy this week's lecture and videos The video is especially eye-opening this week.